Hi, Mr. Jones. My name is Jamie. I'm going to be your nurse today. I reviewed your medical records and you're due to get an NG tube. Is it okay if I go ahead and do that for you? Yes, it is. Okay. Hand hygiene. I'm just going to verify. State your full name and date of birth. Okay, good. So this procedure is not painful. You might feel a little bit of discomfort. I'm just going to take a tube and I'm going to put it down your nose and put it into your stomach. All right, we're going to get started. Close the curtain. All of my equipment is set up. I have my trash bin. I'm now going to measure the tube. So going from the nose to the ear, or the earlobe, and then the xiphoid process, and then a little bit farther down, so about right here. And then I'm gonna mark that tape. And then I'm also going to get my other pieces of tape ready down the line. Alright, I'm going to take this, I'm just going to drape it over you so that you don't get anything on you. An MSS basin, you're most likely not going to need it, but it's there just in case you do. And then I'm getting my water ready. Okay, now I would put on gloves. For now, I'm gonna raise the bed to working height. And then I'm going to position the patient at a 45-degree Fowler's angle. All right, and now we are going to begin. So I'm going to lube this up. All right. I am also going to put this down. Oh boy. All right, ready? Just keep swallowing, keep swallowing, keep swallowing. Okay, now the patient is starting to gag a little bit, so go ahead and tuck your chin and drink water and keep swallowing, keep swallowing, keep swallowing. All right, and we are there. So now I'm just going to put that there. Now I'm going to clamp it, open, get some stomach content. All right, that's enough. I'm gonna get my pH strip. All right, looks good and like we're in the stomach. I'm gonna clamp it again. And I'm gonna put this back in there to make sure I'm not disrupting anything. And then I would send my patient away for an x-ray just to confirm. Okay, patient comes back. It is confirmed we are in the stomach. So now I am going to secure it.
I guess either way, she just said it might be easier. I'm with you. And if she meant it,
Alright. And then put my belt on. Probably should use smaller gloves. Okay, and then also secure it to the patient onto their can. Go ahead and turn your head to the side just to make sure I'm giving you enough room. Okay.
and then make sure they're comfortable and then there's no urine.
And I'm going to attach it to the suction. So I'm going to clamp. Oh, just a twist. Okay, we are now attached to the suction. I'm going to measure the remaining amount with the tape measure that I don't have, and I would document that. And are you comfortable? Do you need anything else, Mr. Jones? Okay, so I'm gonna raise this back up. I'm going to discard of all of my supplies and materials. All right, lower the bed. All right. I will be back later, Mr. Jones. Oh, Mr. Jones, I'm just gonna perform oral hygiene before I go. Just a little bit of oral hygiene makes everyone feel better. There you go. Okay, now I will be back, and I'll be back if you need anything. Next day. Hi, Mr. Jones. My name is Jamie. I was your nurse yesterday. You now have an order to have your tube removed, so is it okay if I go ahead and do that? Okay. Just gotta verify once again. State your full name and date of birth, please. Okay. Cover, close. Okay, so this is, I'm just gonna be removing the tube. Nice and simple, no pain, maybe a little bit of discomfort, same thing. Raise the bed back up to working height. All right. So,
and then you just put the loop of the pulley right there. And then the tube down.
putting on my PPE. I'm just going to remove everything. Well, for starters, I'm going to disconnect you from the suction. I'm going to clamp and then disconnect you from the suction.
Maybe you can ask them, because they're allergic to not, it's like,
There you go. I'm just going to take all of this tape off you. Good. How you doing, Mr. Jones? You still doing okay? Okay. Now I'm just going to cover you with this before we start to make sure you don't get anything on you. And I'm also going to disconnect your robe. All right, are you ready? We're gonna go on 3. 1, 2, 3. And before that, I would have flushed with 10 milliliters of water to make sure I'm not getting any gastric contents anywhere. But it's too late for that now. Now that's out, how are you feeling, Mr. Jones? I'm just going to provide some more oral care for you. I would measure the contents in the suction device. I'm going to raise this back up. Lower my bed back down. All right, Mr. Jones, thank you for letting me be your nurse today. I hope you have a great day.
we'll make sure